So welcome to our next talk. We have Amy Powell from UCANN, and she does the thing that people in this building are most curious about, which is the patient consultations. So I'm going to turn the mic over to Amy so she can tell you how she does that and what's going on with UCANN and Act Now. So here's Amy Powell. Thank you.
Hi, good afternoon. So my name is Amy Powell, and I am the head nurse and the director for the Act Now program that we have created through United Cannabis. United Cannabis, this is just giving you a little bit of our mission and what our vision is. We are a biotechnical company, and we are very patient-driven. Patients are number one in our book. We have, as we were just talking a little bit ago, in 2016 we were actually issued a patent on the manufacturing of cannabinoid products.
Can you go back to that one
Yep.
slide, if you don't mind?
Absolutely.
Thanks.
You get it too? Got it. So these are countries that we are currently in. We're in the United States. We also currently have work in Australia and work in Canada, and we also are in Jamaica. We currently have clinical trials, open label clinical trials going on in Jamaica right now with high doses of THC, and if you can believe it, actually cannabis naive patients in Jamaica. I know you've heard a lot about the endocannabinoid system, so I'm just going to kind of show you some slides just that we do have CB1 and CB2 receptors and where they're located in the body. Your CB1s are located more in your central nervous system, and then your CB2s are more in your periphery and really affect the autoimmune system. This is talking about just showing you a little synopsis of the endocannabinoid system. The most important thing to understand about the endocannabinoid system is it is what brings hemostasis to the body. And if we don't have hemostasis to the body, then we're allowing things to grow, such as cancer, autoimmune disorders, and things like that. So when you increase the CBD that you take in your body, you're increasing that hemostasis and you're bringing equilibrium to the body, which is the most important thing. I'm a strong believer in CBD. I think everyone should take it every single day as a vitamin. These are just going through the different mechanisms, which everyone knows the mechanisms that cannabis or hemp products can be taken in. Smoking, obviously, that can be done smoking. There's vaping. This is actually how they do clinical trials in Israel with their vape machines so they can really regulate it. Israel is one of the largest in the world who does all of our research and everything on cannabis related to medicine. We have infused edibles. I personally am not an edible fan, but edibles also, in a sense, fall under capsules, which we do. But I'm not a fan of edibles in the sense of like gummy bears and things like that, because for treating patients medically wise, because I don't feel that they are going to get 100% the same effect or the same dose every time. But that's just my personal opinion. Then we have cannabis juicing. This is huge for cancer patients. This is taking the whole plant, so the leaves, all of the stuff that has been, that's waste on the plant, and actually juicing it. And it's showing to be really effective on cancer and things like that. We have topicals. Transdermals is another mechanism of use for CBD that's really great as well. We actually have a cannabis line that we do THC topicals and different ratios of CBD and THC topicals. Sublingual, this has the highest bioavailability in the body, is taking it sublingually. You're putting it under your tongue and it's absorbing directly into the bloodstream because your mouth is full of millions and millions and millions of capillaries. So taking it sublingually is going to give you the quickest effect. Vaping does the same thing. And smoking can give you a quick effect, but sublingually, medically wise, is probably one of the best options of taking medicine. And this is just showing you how to get sublingually. And then we have our phytocannabinoids and our cannabinoids. CBG is one that's becoming very popular now, that is not talked about a lot, but is really becoming used quite a bit. We have THC. We all start out with non-active or the raw form. So we have THCA, and then we have CBDA, and we have CBDNA. And then after they're heated, they change to THC, CBD, and then you have CBN. This is what creates whole plant cannabis. Taking good cannabis, you have to have your terpenes. Terpenes are the essential oil of the plant, and myrcene and limonene are probably my two favorites. Pinene is also wonderful, but it's so important. And lots of people will say they have full spectrum or they have whole plant cannabis, but they really don't. They're adding in flavonoids or some type of additive. It's not the true terpene out of the plant. It's not the natural state of the terpene, which is so important. And then this is just showing you how raw, where it converts from raw to heated, and then over time, THC will then, and over time, convert to CBN. But this is just showing you raw, which we offer a full line of products that I'm fixing to go over in raw and active form. So, Prana Products. So this is our cannabis line that is in California, and we are associated with the largest dispensary and the oldest dispensary in the world, Harborside, with Stephen D'Angelo in that group. We have a strict, we make their medicine. And so Prana is our line that we carry out in California, and we have it, the different levels, P1, 2, 3, 4, and 5. They come in capsules, sublinguals, and they come in transdermals. And we also have balms as well. So these,
Why do you call them P1, 2, 3?
it just was an easy way, our product name is called Prana, and it was just an easy way for us just to go, instead of saying you're taking a 25 to 1 or you're taking a this or that, we just labeled it P1, 2, 3, 4, and 5. We do have other scientific names for when we get to our research, because researchers don't like to see P1. So P1 is 100% THC. It comes in both the active and it comes in the raw form. Tinctures, all of our tinctures are all raw. So to activate those, you have to actually put it in the oven at 240 degrees for 45 minutes, and then it will become an active form of THC. Our P2 is a 3 to 1. This is probably my favorite in our cannabis line. And I always recommend patients take this during the day raw, because it really gives them, they have that effect with the THC, the low dose of THC, but get really high doses of CBD. Our P3 is a 1 to 1. And then we have our P4, which is a 1 to 1 CBD to CBN. We have this in our cannabis line, but we also have it in our hemp line as well. In our P5, which is our 99% CBD product, that we also make in our hemp line as well, which does not have any THC detected at all, even though this one has a low amount because it's cannabis. So the difference, here's the difference in Prana versus your other products, Treatwell, Moxie, any of those other types of brands. Our products are 100% plant-based, hypoallergenic. We're accurately dosed, that's really important. Each drop from our tincture is 1 milligram, and our capsules come in 10 milligrams, 20 milligrams, and 50 milligrams, so it's just like taking a blood pressure pill. So for physicians, it's really important that they can really dose a patient, you know, by taking a capsule or microdosing them versus with the tinctures. We don't use any solvents. It's ethanol-free, calorie-free. The patented, it says patent pending, but we have the patents now. And each category is formulated, like I said, with whole plant cannabis, including the original terpenes that are in the plant. This is showing you our capsules and what they come in the dosage-wise. These are our bottles for our Rollon. So this right here is like a massage oil. It comes in a large bottle. This is used a lot with patients who have CP or have just injuries. They can take this bottle to their masseuse. If they're using the 100% THC one with the high THC, I always tell them to recommend their masseuse wear gloves because the masseuse will become really high. So, but it's really good for patients who have chronic pain and back pain and things like that. And these are our sublingual drops. There is 400 milligrams, which I said 1 drop is equal to 1 milligram, so there's roughly 400 drops in a bottle. And this is a chart that you can find on our website called the Act Now program, and this just kind of breaks down. This is really, patients love this chart, that they can go, if a patient doesn't register with us with the Act Now program, which we're fixing to talk about, they can go here and kind of give them a good idea of what they could go purchase and help treat them. If you're interested, I mean, we have these in our hemp line. So these are things that, so our P4, which is our CBN, or our hemp PM, these are things that it works really good with, that they're very helpful with insomnia, PTSD, and those types of things. So our Prana hemp line, which is our line that's located here in Colorado, that is grown, and we're a complete vertical manufacturer of our hemp line. We have the aromatherapy, which is award-winning. Rollon, that is 65 milligrams of CBD in the Rollon. That's really good to put like in joints for arthritis. If you have gout, things like that, that you could just put in. Tension in your neck, if you slept wrong or something like that, you could just rub the Rollon in and will absorb really quickly, and it smells wonderful. Then we have our CBD, or our hemp drops, that is, like I said, 1 milligram per drop that patients can take on it, and I recommend them take this in the morning. And then we have our PM drops, which is our CBN. This is our full line of our hemp products that you can find on NutriMed. NutriMedHealth.com is the website that our products are located on. And we have this, our balm, which is phenomenal. It's a nectar balm, and it's award-winning as well. And then we have our Youth Thrive, which I'm going to talk a little bit more. That's, we're a biotechnical company, and it's not related to, doesn't have any cannabis in it at all. So, our Youth Thrive, Prana Therapeutics is another, it's a sister company of ours. Prana Therapeutics was founded and created by Dr. Brent Reynolds, one of the founding people of stem cells. And he created Prana Therapeutics, and United Cannabis has teamed up with him to be able to bring Youth Thrive, or EDP, is what he patented. And it's a compound of taking 3 compounds together, and then he just named it that ephediagram, but it's easier to say EDP. So this is what EDP is made of. It's made up of green tea, curcumin, and sulforaphane, and these are high anti-inflammatory. It's really concentrated. The bioavailability of taking our capsule versus just taking a regular turmeric is over 250% bioavailability because of the way it's concentrated down. And then advanced cannabinoid therapies. So this is me. This is my baby. Advanced Cannabinoid Therapy, it stands for Act Now. So Act Now is our program that we created. It's a HIPAA-compliant program that we run a patient portal just like a doctor's office. Patients register with us through the Act Now program, and then they are given a consult with the nurse, which is me, and we go over all of their medical history, what medications they're taking, what are they trying to treat, and we give dosage recommendations based on our Prana products and what they should start out with. We do follow-up calls every couple of weeks or however often patients want that. They always have access to me via email, and this is something that we offer free of charge to our patients. Yes?
I know you're an RN,
Uh-huh.
but isn't that the practice of medicine when you're giving out dosing and treatment?
It's recommendation. I'm giving you a recommendation on what you would take. I'm not prescribing. I'm just giving you a recommendation. On our anecdotal data that we have, we've created set protocols for certain conditions, and so I give you recommendation of, I would start out at taking, 5 drops of CBD twice a day and see how you feel with that. I work hand in hand with lots of physicians.
Well, what happens, I'll just use
Yeah, go ahead.
my situation as an example for anybody else. You heard me say that my wife has temporarily at least
Right,
metastatic breast cancer. Can't say she's cured.
right.
But nobody that we've spoken with, including me talking with Mashula and his chief assistant, nobody knows what a maintenance dose is.
So, yes, so for me, when I see, for a maintenance dose for patients, when I see what dosage they have to get to where we see changes, like they're taking 200, so our cancer protocol is P2, which is the 3-to-1, and our P3, which is a 1-to-1. They take the P3 at night and they take the P2 during the day, and based on where they get milligram-wise, so say they get to 100 milligrams of P2 and P3, and they become not cancer-free, but they become stable or they become in remission, then they don't throw that word out very often, but if they get there, then it's based on where they are on their dose. So we usually will go down to half of that. So I would say if they get to 100, then their maintenance dose would be at 50, because you have to make sure you keep that hemostasis in that body saturated. And then it's just monitored by their labs, their PET scans, and things like that.
But what about, if you will, taking time off from the, if you will, flooding her CD1 and 2 receptors with an inordinate amount of cannabinoids? To what extent does your recommendation or your analysis take into effect that you may need to give somebody's receptors, if you will, some time off? That's the wrong technical term.
No, I understand what you're saying. So let your body reset.
Yes.
So I usually will tell patients if they start seeing, at about 6 months, I'll say you need to reset your body. Take 3 days off and then let's go back. Take 3 to 5 days off and then let's reset or undo.
Gives you a reason.
Yeah, and now I'm going to do it. Yeah, so that's going to be something that I will recommend to patients now, actually. But so that's something that, to let the body reset itself. But this is, so we're just going to go back. So this is our HIPAA compliant patient electronic health medical record. That's a cloud. We use Health Fusion, which is used in a lot of doctors' offices. This is our website, Act Now Program. It's actnowprogram.com is the actual website. And this is where you can find out about us, the cannabinoids, our programs, and our products. And you can also go here and purchase our hemp products as well. It'll direct you to the Nutriment site. But this is the important thing for patients, is to make sure they go to sign up. A lot of times patients will go to contact us and say, hey, I want to talk to the nurse, or hey, I want help with this. And that's not going to get you to me, because I'm not going to talk to you until you're a registered patient and I'm HIPAA compliant, because I'm not going to take that $40,000 fine. So when you register, when you click sign up, this is what's going to pop up, and it's going to ask you all these questions, and you'll fill them out and you can mark out. Medical center, it's going to give you California, but for our hemp-based patients, we just tell them to pick. It doesn't matter. We don't really look at where you're located, because that's the important thing of being HIPAA compliant. Is that's really important to patients to know that I can't give out your information, because most people are, cannabis refugees. I was one of those. And this is a chart that I create for the patients, and it gives them their dosage, what they take, what their recommendation would be, what the products were, and this is what's given to them, and this is what's put in the chart. So anyone, our medical director, anyone like that can go in the patient's chart and see the recommendations of what they're taking, and I also add nurses' notes at the bottom for them as well. And then this is where the contact us is, and they can just go, the contact us is just something that just sends us an email through the Act Now program. These are our two patients, these are on our testimonials on our website, the Act Now program. This is one at William, which is a child with autism that we have basically given him a normal life in the sense of using Prana products. And then this is a patient that actually has been cured of cancer of acute myeloma that was taking Prana.
How many patients have run through the ACNOW program?
Roughly about 25,000. So it's a large, so we have a large amount of anecdotal data to give pretty accurate or helpful recommendations to patients. These are all of our partners, and we have CRD, which is our partner in Jamaica. Any questions?
So you're not in Colorado?
We are, yes, we are in Colorado. We have a hemp line. Our corporate offices are here in Colorado. United Cannabis is based in Colorado, here in Denver. Our hemp line is produced and created here in Colorado. Our cannabis line, which carries our THC, is manufactured and created in California.
So you don't have THC in Colorado?
No,
Not
so,
currently.
You have to be in the system, so we haven't, we've decided to focus our efforts on industrial hemp in Colorado and let California kind of be our hub for the full spectrum line. We do intend to break into that area sooner than later, but our main focus is on industrial hemp at this point.
So if we wanted to purchase products that have THC, we have to.
You'd have to be in the system in California or go through a recreational vendor in California that carries our line. So.
And that's easy to find out.
Yes, sir, correct.
Yes, if you go back, if on our website in the top right-hand corner, it'll say locations. It'll actually give you a map of all the locations, all the dispensaries that carry Prana products. It'll say full line. Some only carry the topical line in California, but it'll tell you and it'll give you their phone number, their email address, their website, because a lot of the dispensaries will keep an updated products of what they have in stock. Yes, ma'am.
So your hemp line, are you able to ship that?
Yes.
Yes, it's sans THC. We start with, we break it all the way down to isolate and then constitute backwards. So we reintroduce the terpenoid profile with the isolate and work from there. So it has zero THC, there's no issues. We have a lot of military personnel taking our medication, so they can't afford it.
And the Act Now program is available to all hemp line patients as well.
And you can get them in medical dispensaries here, or it's all mail order, or how?
It's some dispensaries are, haven't started carrying them yet. That's, something that we're getting into is putting them in dispensaries. We're very particular on who carries our products, but you can purchase them online and they can be shipped to you. And the website is NutriMedHealth.com is the website to be able to purchase our, the CBN is the one that's so hard to get. That is the best of everything. It's so great for patients, and I see you yawning, and it will help you sleep. So it's really good for anxiety, PTSD, and those types of things, especially for patients who have severe panic attacks, or we use CBN a lot with autistic patients. So if they go to the dentist, or they're going to therapy, or they're going to something like that, and it gives them a lot of anxiety, they take a dose of CBN before they go, and they're able to handle that situation way better.
Do you have any observational studies about the CBN and autism?
Yes. So our creator of our medicine, Tony Benzura, just actually did a podcast with the autism. I can't think. It's Healing Autism Naturally, I think, is what it was. And he did a podcast on how to treat autism with our cannabis line, our P3, our 1-to-1, but also using CBN in treating, helping with autism. Anything else?
I have a few questions. How do you guys know that your sublingual formulation is actually sublingual?
Well, you're putting it under your tongue, so you absorb it, you hold it for 30 seconds to a minute. Your body's gonna absorb as much of that as they can, and then you swallow the rest. But, so yes, you're not getting that full dose, but you're getting what your body will absorb at that point, which is going to be a higher bioavailability and a quicker onset, 10 to 15 minutes.
Right. I was
Yeah.
just wondering if you had any data on how much you're absorbing. Like,
No, because it depends on every patient, you know, how much saliva do you have there, how much, you know, that type of thing.
So to extrapolate on that one, what we found was that the specific delivery mechanism that we use has roughly 300% more bioavailability than the average MCT on the market. So we can, I can get you, actually, I'll email you information on that, but that's the relative comparison we have to the average MCT, olive oil, coconut oil, things of that nature. Yes, sir. And the capric fatty acid that we use is very specific, it's polarized. Grabs what we need, leaves what we don't, and it allows to travel through various membranes that allow for higher rates of uptake. So again, what we've been able to gauge on average, because there's no standard in what MCT oil is used, it's roughly 300 times more bioavailable than the average MCT that's used.
So you said capric, so it's an MCT itself.
It's very specific
Very
capric fatty acid for sure. Yes, sir. Yeah. So and then on top of that, there's a very specific number subsect to that specific capric fatty acid. So it's number 18 of XYZ, and so we use it very specifically for its ability to travel through various membranes that most oils can. So yeah, but I can actually share all that with you. So I'll get you all that information. I'll throw it out to you. Love to discuss it.
Yeah. The other question I had was, as far as you're doing a lot of like observational study with your patients and everything, are you doing or encouraging any kind of blood testing panels or genetic testing?
So yes. So genetic testing, yes, to know what specifically, patients, what specifically will work on you. Yes, that is something that actually Tony talked about on the podcast as well, is doing and having that done. In Jamaica, in our clinical trial, yes, we're blood testing those patients with the THC that are taking the high doses of THC as well. So yes, in the United States, we can't do our clinical trials. So things are coming. They're getting there. So it's kind of exciting to see that the universities are opening their minds to.
And to go on that, in Jamaica, we're actually doing our PK studies right now. So we're in the PK phase of that. And with the EDP at the University of Florida, we just got awarded our IND. So we're moving towards that and doing various side-by-sides, open labels and wide labels in regards to 3 different things. One, arthritis, cancer, and back pain. But also when you use that, we're finding a lot of synergy with those non-cannabis-based compounds and cannabis. So we're also moving that in other directions as far as mitigating the effects of chemotherapy. So it's kind of where we're focusing on right now. Yeah, and I'll get your email. I'll send all that.
I'm sure we'll cover it.
Yeah, and that's my email. So if you ever have any questions or anything, you can always email me. Yes, sir.
So back to the same kind of question about cancer as for autism. Do you have observational studies? Because the milligrams you're quoting are quite different than you see when you get RSO and stuff like that.
Right, and that's created, and that's where a lot of patients come to you, and they're like, well, no. I mean, I read on the internet that it says I need to be taking 3,000 milligrams, or I need to be taking a whole gram. The difference, in which Jonathan just pointed on, is the MCT oil that we use makes the bioavailability 3 times what it is. So when you're taking, 10 milligrams, you're taking over 33 milligrams. So it's, your bioavailability is much higher. It goes through the lymphatic system, past the liver and through the lymphatic system. So your body's able to absorb so much more of it than the RSO. The RSO, you lose all your terpenes, which is so important in everything when you are trying to treat cancer. So you're losing all your terpenes in RSO. And with our products, you have the terpene, you have the whole plant. And you don't gain, you only absorb I think it's about 45 to 60% of the RSO when you take it. In that little grain of rice.
Okay, so the question still is, do you have studies that show that your dose works just as good?
Studies, no. Anecdotal data from treating the number of patients that we've treated, yes, that's what created and allowed us to create our protocols that we have for treating cancer, or giving a recommendation on what to do treating cancer. Yes, every patient's different. You're going to require a different dose than I'm going to require. So that's where it's very patient specific, and that's why it's important, to help them and guide them, because it's going to change. I have some patients that, I have a patient who has prostate cancer. He takes 20 milligrams of P2 and P3. He already sees results in his PSA coming down. But I have patients who are taking 50 to 70 milligrams and they're not seeing changes. And they're the same stage. And their PSA was the same. So it's just really a matter of finding when is that body going to be saturated and bringing hemostasis to the body. So, all right. Thank you guys so much.